when that happens? Can you give us the dates and?
Certainly, we will provide more details on his travel before it takes place. Great. Yes.
There's been some news about vaccines and the White House saying that these AstraZeneca vaccines are going to start going to other countries. I wondered if you could give us a bit more on the process for deciding, who's going to get vaccines when the US is giving them out. I guess is this you've talked before about giving money to COVAX.
Mm-hmm.
I think what the word from the White House today was that these would be distributed through direct partnerships. So does that mean not through COVAX? And are you choosing to give these to countries based on need, or is this based on relationships and not obviously what the Secretary said, not political favors, but what is the basis for this?
Well, I would say broadly that it's based on a couple things. One is the broad recognition that as long as this virus is spreading anywhere, it is a threat to people everywhere. That point applies to COVID in India. It applies to COVID in the United States. It applies to COVID anywhere around the world. And so that is why we have consistently spoken of our efforts not only to get the virus under control here, recognizing that the United States has been the site of the world's worst outbreak to date, but also recognizing that as long as the virus is circulating here, it poses a threat and continues and has the potential to continue to mutate, to pose a threat well beyond our borders. But that's also why, since the very first days of this administration, in fact, the very first day of this administration, President Biden has committed the United States to be a leader when it comes to global public health, re-engaging with the WHO on day one, committing $2 billion to COVAX immediately, another $2 billion over time as well. The loan arrangements we've discussed and we've talked about in the context of Mexico and Canada, and of course our engagement with the Quad that will seek to increase production capacity within India itself. Let me just spend a moment on the situation in India, which of course is of great concern to the United States, and we have always stood in solidarity with our friends and our partners in India. We are working nonstop across the government to do all we can to deliver on an urgent basis the supplies most needed within India, and that includes oxygen assistance and related materials, but it also includes supplies of therapeutics, rapid diagnostic test kits, ventilators, personal protective equipment or PPE, all supplies to protect India's frontline healthcare workers. It includes raw material urgently required for the manufacture of the Covishield vaccine. And we've also deploying an expert team of public health advisors from the CDC to work in close collaboration with our embassy on the ground, India's health ministries, and India's epidemic intelligence staff. Now, of course, these details that we've released in recent days follow regular consultation and discussions with our partners in the Indian government. Of course, the president had an opportunity today to speak to Prime Minister Modi. The secretary has had an opportunity in recent days to speak to his counterpart, Foreign Minister Jaishankar. Jake Sullivan, the National Security Advisor, spoke to his counterpart. Wendy Sherman, the Deputy Secretary of State, spoke to her counterpart. And we've been doing that to demonstrate our solidarity with the Indian government, with the Indian people, but also to hear about the needs of the Indian government and to assess, based on our own capacity, what more we could do. We've always said that as we are in a position to do more, we will do more. And this gets back to the issue of President Biden's commitment on the part of the United States to continue to be a leader when it comes to humanitarian relief and a leader when it comes to global public health. What we are talking about today in the context of India is a natural complement to what we've been doing over the course of this administration, doing what we can to be a leader in terms of the global response to this virus, even as we continue to address it here at home with our vaccination drive.
Does that mean that India is a priority, or how are you prioritizing? That was
Well, it is. It certainly goes without saying that India is enduring a horrific outbreak. India is a global comprehensive. We have a global comprehensive strategic partnership with India, but the Secretary has been clear. This is not about shots in arms in return for political favors, in return for any sort of transactionalism. This is about America's humanitarian leadership, the commitment that this administration has to help those most in need. And of course, what India is enduring now is profoundly concerning on so many levels. And so that's why you see not only the United States stepping up, but other countries in the region and well beyond stepping up to attempt to help and do all we can to help India in its time of need.
Yeah, why is it taking so long? You say you have these public health advisors and intelligence people on the ground. Presumably they saw this coming. Is it China's criticism? Is it what's causing it? Is it the stories in the press? Is it it seems like the Quad would be monitoring this. Isn't disaster relief one of the founding parts of the Quad? I'm just wondering why we're just seeing this surge of attention on India right now when we talk about this deep and strategic partnership.
Well, I would take issue with the premise that it has taken us a long time. I would note that, of course, we have talked about our stepped-up assistance to India in recent hours, and we've always said, as we assess we're in a position to do more, we will do more, and you have heard us make good on that pledge. But from the earliest days of this pandemic, we have provided much-needed assistance to India, just as India came to our aid when we were enduring the worst of the pandemic here in this country. Since the beginning of the pandemic, the United States has provided nearly $19 million in total assistance, and that includes nearly $11 million in health assistance to help India slow the spread of COVID-19. Our assistance has helped India provide care for the affected, disseminate essential public health messages to various communities, strengthen the epidemiological surveillance capabilities, mobilize innovative financing mechanisms for emergency preparedness and response to the pandemic. These funds, this nearly $19 million in support that we provided since the start of the outbreak have also supported Indian state-specific COVID-19 challenges and addressed bottlenecks in supply chains that stem from the lockdown on India's border. $2 million in that assistance is also supporting micro and small and medium enterprises in areas hardest hit by COVID-19. And as I alluded to before, the CDC has committed $3.6 million to assist the government of India's response to the epidemic. Those resources are trained at prevention, preparedness, and response activities in India. So it is certainly not the case that what we have spoken to in recent hours is the start of our engagement. But we recognize that as the current outbreak has taken incredibly concerning turns in India, that there was more we could do. And we, in consultation with our Indian partners, have determined that the steps I referred to earlier are available to us, and they would be of great benefit to our partners in India.
I mean, is there more to come? You talk about 19 million here, 3.6 million there in a country of that measures its population in terms of a billion. Is that going to be enough to stop or to address the pandemic there?
Well, I think the two premises I referred to earlier. As we are able to do more, we will be doing more. We are making good on that promise now. And also the recognition, again, that as long as the virus is circulating unfettered anywhere, whether that's here in the United States, whether that is around the world, that poses a threat not only to the American people, but in turn to people well beyond our borders with the ability to redound back on us. So we are doing what is in our national interest, but we're also doing what's in the collective interest. And it just so happens when it comes to global health, oftentimes what's in our national interest is also in the collective interest. And that's what we're seeing here.
Jack, what is the State Department? Does the State Department have any specific role in getting the vaccines out to the, or are you...
In terms of the logistics of that?
Yeah.
So I would refer you to the White House to discuss logistics. They've obviously talked about AstraZeneca in the context of, in today's context. Now, of course, we do have Gail Smith, who is playing a key role in all of these efforts. But I would make the point, I would hasten to add that her role goes well beyond vaccines. And I know there's been a lot of attention paid to vaccines, but that's really just one element. When you talk about Gail's role as coordinator for global COVID response and health security, she has a role that involves diplomacy. That is to say, leading engagement for the U.S. government with foreign governments and partners around the world, multilateral entities, other executive branch agencies, Congress, the private sector, and the general public. There is a strategic element to all of this as well, providing strategic guidance, coherence, and prioritization for the formulation and implementation of an effective global response to COVID-19. Of course, that requires coordination, which is also a big part of her role, driving that coordination, driving that prioritization within the department and throughout the interagency, pursuant to what's most effective for global response efforts. And she's also undertaking and participating in the department's structural review of the longer-term organization of states' global health security portfolio. We know that COVID, unfortunately, is not the first outbreak or epidemic, and unfortunately, we know it won't be the last. And so we want to ensure that this institution, both now and going forward, is best structured to respond effectively, and that's part of Gail Smith's role here as well. Yes. One more in India, sure.
Can you speak to reports of a outbreak among U.S. diplomatic staff in India? Say how many are affected, and if perhaps considering that the U.S. might be looking at authorized departure.
So I'm not in a position to confirm any cases within our staff. Obviously, privacy considerations limit what we can say. But as I've mentioned during the course of this briefing alone, India is enduring a deeply concerning outbreak, and the entire country has been affected. We obviously do have a large diplomatic presence within India. It is tantamount to the deep engagement and partnership we have with India, but I'm not in a position to speak to any cases within our staff or embassy community. Yes.
The president, and by extension this administration, will be marking 100 days in office on Thursday. What will you say have been the biggest or the top achievement of this administration in the past 100 days?
Well,
For Africa.
For Africa. Well, certainly, of course, the Secretary will have much more to say on this in the course of his virtual trip tomorrow. We're also, and I'm mindful of the clock because we are doing a preview of that trip at 4 o'clock where you will hear more. But what I will say is that we have engaged the African continent deeply during the short course of this administration. You may recall that President Biden addressed the African Union Summit, his first direct address to foreign leaders in this administration. And I think that was noteworthy, not only because of how early it came within this administration, but as a signal to our commitment to our partners on the continent and to the AU as a multilateral institution in this case. We'll continue to engage regularly, openly, and candidly as partners in pursuing those shared interests and shared values. We have much in common that goes well beyond security. It includes global health, it includes climate change, it includes freedom and democracy and shared prosperity. We have engaged deeply within the Horn of Africa, of course, and we've spoken already to Senator Kuhn's engagement. We announced last Friday the appointment of Ambassador Jeff Feltman as a special envoy for the Horn of Africa, which is emblematic of the level of priority this administration is attaching to issues on the continent and issues that affect the totality of the continent. We also, and Secretary Blinken will have an opportunity to engage tomorrow, will continue our people-to-people programs. With a population of 1.3 billion and a median age of some 19 years, we recognize that Africa's youth are one of the continent's most important resources. And that's why programs like YALI, that is why the public diplomacy work that takes place within and on the part of our embassies and posts throughout the continent are so important, and we'll continue to develop those going forward as well.